So those are the three big ones: psilocybin, MDMA, and ketamine.
Yeah, right now. Yeah.
And you've worked with all three?
Yep. Yeah. Mm-hmm.
And which one? And so MDMA is classically for PTSD.
Mm-hmm.
Psilocybin for depression, and ketamine would be for.
Ketamine is used also, like it's approved as a treatment for treatment-resistant depression. It's really good for acute suicidality. So it's primarily used for mood disorders. However, it's also can be quite good for post-traumatic stress and helping people process trauma. And I would say psilocybin, it's really interesting. It works for a variety of different things. And it works for a lot of disorders where the mind gets stuck in these like repetitive patterns of thinking, which then lead to repetitive behavior. So it's showing a signal for obsessive compulsive disorder, for the rumination and depression, for the perfectionism of anorexia. It also does cause this kind of pretty powerful behavioral reset. And so it's showing pretty promising early results for addictions as well. And then I think the final big one is end of life distress. So psilocybin's really used kind of transdiagnostically.
Are there any trials dealing with ayahuasca or DMT?
Not ayahuasca in terms of like taking that out of its lineage, out of the jungle into the clinic. I think that people are looking at another form of DMT called 5-MeO DMT that's being studied for depression and other indications, and NN-DMT, which is the active ingredient in ayahuasca. So there was a trial at Imperial College where they were giving people IV infusion. These were healthy volunteers, but they're giving them IV infusions of NN-DMT to be in this
DMT.
Extended state.
Right.
I think they were really interested both in what was going on in the brain, but also with the subjective phenomenon that where people are experiencing.